Hello everyone, today on the eve of World Diabetes Day, I would like to introduce you to the world of diabetes to understand what exactly it is. So today, as we all know, based on the ICMR in-depth study, it's been evaluated and seen that we have got around 101 million diabetic patients in India, out of which over and above that there are around 136 million pre-diabetics, and these are the major chunk of the patient in whom we try to prevent diabetes. The difficult part in this situation is these category of patients usually don't turn up to us because they don't have much of symptoms, right? So what we do is, in all our diabetic patients, we usually tell their relatives to do this HbA1c test, by which we come to know whether the patient is a pre-diabetic, is a diabetic or non-diabetic, right? So there are a lot of preventive advanced treatments to prevent the further progression of the disease towards diabetes. But the difficult part is people don't turn up because the only symptom of pre-diabetes is after having a full meal, they usually get a lot of hunger pangs immediately after 1 or 2 hours. So since the patient is eating well, that's why the patient doesn't come to us. But this is the first stage of pre-diabetes, so you have to be aware. You need to understand that we can do a lot in this stage, because once you become a diabetic, there is nothing more that we can do. There is nothing called as the reversal of diabetes. We can put you into remission because there is a lot of damage to your beta cells in the pancreas which cannot be revived, and the entire research towards diabetes is to either regenerate the beta cells and or either replace the beta cells, but we are not getting that much of success. But there are beautiful studies to show that in future we can come out with it. But currently, only thing that we can do in diabetic patients is we can put you into remission only in the initial few years of the disease. After you cross a certain period of 5 to 10 years or 15 years, it's very difficult because there is extensive loss of beta cells. But remission can be done in the initial few years of diabetes. But pre-diabetic is a stage wherein if we come to know that you are a pre-diabetic, we can prevent diabetes in a lot of patients. I have a pool of around 500 patients in whom we are preventing diabetes since last 14 years, and we can do a big thing to do that in that area, right? So now steps to prevent pre-diabetes is the same as we tell to our diabetic patients. One is to have a complete balanced diet, right, in equal proportion in all the areas, right? Don't keep very long gap between 2 meals. Go for a regular physical activity. Stay away from major addictions like alcohol and smoking. Non-veg foods you have to eat in moderation, not in excess. Restrict your oil intake, right? And have a lot of high fiber foods and high protein foods, and keep your carbs to the moderation and fat to the minimum, and increase your physical activity. These are the few things that you have to do to prevent pre-diabetes, but that preferably should be under the guidance of your either an endocrinologist or a diabetologist who can guide you towards prevention of diabetes in future. But the problem is usually these category of patients don't reach to us. So what I would promote through this video is be aware, understand that rather than treating diabetes, preventing diabetes is a very big stage, and we can do a lot of things in these areas to prevent diabetes in future, right? And that's why screening yourself with a test called HbA1c with either HPLC or boronate affinity method preferably helps you to take a guide where exactly you are landing up. Like for example, we tell a patient if your HbA1c is below 5.7% and you don't have any known risk factors or any of your parents are not diabetic, then you can just stay calm. You don't have to worry about it. But if your HbA1c is between 5.7 to 6.4, you are definitely a pre-diabetic, and you have to take steps at that stage itself. Because if we don't pay attention to it, we are going to land up into diabetes in future within 6 months, 1 year, or 5 years down the line. And that is not reversible, mind you, once you become a diabetic. Once you cross an HbA1c of 6.4, there are very few rare patients who can come back to 5.7, because you need a lot of discipline in your life, you need a lot of good physical activity, you need to balance your diet well and equal proportions, and you have to have a lot of fibers and proteins in your diet. So if you are able to maintain that, we can achieve that even without medications. But the initial period where we have to prevent pre-diabetes, starting from pre-diabetes to diabetes, then there is a lot of treatment, right? So you need to reach to us before you land up into diabetes. So with this, I would like to end my video. The only part, the moral of the story, what I would like to tell you is that be aware about pre-diabetes, because this is something which is going to make you land up into diabetes in future. Thank you so much.